Hi, I'm Dr. Christina Zigler, and I'm assistant professor at Duke University in the School of Medicine, and that's in Durham in the United States. I'm also first author on a paper that was recently published by the British Journal of Dermatology, and that was titled A Novel Patient-Reported Outcome for Pediatric Localized Scleroderma, a Qualitative Assessment of Content Validity.
And I'm Kaveh Ardalan, Assistant Professor of Pediatrics in the Division of Rheumatology at Duke University School of Medicine in Durham, North Carolina, United States. Also with an adjunct faculty position at Northwestern University in Pediatrics and Medical Social Sciences in Chicago, Illinois, United States. I'm also a co-author on this paper.
So we performed this study to develop a valid way to capture the impact of localized scleroderma on the health-related quality of life of children and adolescents. So we used an iterative patient-centered development process for this patient-reported outcome, which is commonly termed a PRO.
So first, we utilized previously collected qualitative data from youth with localized scleroderma to develop survey items. Then we administered the items to a representative sample of individuals with localized scleroderma aged 8 to 18 years old. We then conducted cognitive interviews to evaluate how well the survey performed. We assessed readability of the items and also if participants could explain the meaning of items in their own words. We also looked to see if the survey was missing any important aspects of individuals' lives with localized scleroderma.
So we had 17 children and adolescents participate in our cognitive interviews, and overall the survey performed quite well. So children and teens were able to read the items and explain the item meaning in their own words. There was some limited understanding in the youngest children in our sample, so those 8 to 9-year-olds. So what we did was we simplified the instructions and reformatted the survey to make it easier to complete. We also ended up adding 3 additional items based on participant feedback.
The final version of the survey included items about uncomfortable skin sensations, limitations in physical functioning, body image and social support, and side effects of systemic medications.
So all the qualitative data that we collected really supported the content validity of this new survey, which we titled the Localized Scleroderma Quality of Life Instrument, or the LOSCI. Although this is a really important first step, our next step that we're currently undertaking is to capture quantitative psychometric evidence from multiple sites across the United States and Canada.
The study is relevant to dermatologists and patients. Previously, there were no existing surveys or outcome measures for this particular population. We found that surveys that were being utilized in the past did not fully capture the experiences of individuals with localized scleroderma. So we ultimately hope that this patient-reported outcome measure will be used in clinical and research settings to more fully conceptualize and understand how children and adolescents are affected by localized scleroderma and its treatments. And we're hoping that this brings the patient voice into clinical care and treatment studies. Thanks.
Thank you.